Hi, welcome and thank you for joining me. My name is Christy Wilbert, Director of Medicare Marketing for URL Insurance Group. And today we are doing a webinar on Medicare 101. I'm hoping by the end of the presentation that it piques your interest to start writing Medicare. So first, I'm going to give you a few Medicare statistics. There is a ton of opportunity to sell Medicare. There's about 10,000 individuals turning 65 every single day. And that number is only going to increase as 78 million baby boomers will become eligible over the next 20 years. Currently, we have 53 million people enrolled into Medicare, and out of those 53 million, only 40% are enrolled into a Medicare Advantage plan. So big margins there to get people enrolled into Medicare Advantage plans. And then also 25% of those people have an annual income of less than $14,000. So as you can imagine, those individuals really need assistance and an agent to look out for their best interest and make sure they're taken care of with their health care. So what is Medicare? It's health insurance for people that are 65 and older, under 65 with certain disabilities, and if you've been diagnosed with end-stage renal disease or ALS. Medicare is administered by CMS, and they also regulate it. There are 4 parts of Medicare. We'll be going over each part in more detail, but Part A is hospital insurance, Part B is your medical insurance, Part C is Medicare Advantage plans, and Part D is Medicare prescription drug coverage. Part A, your hospital insurance. It's free to most individuals that have paid FICA taxes for the last 10 years. If you haven't for 10 years, it'll be prorated premium-wise. And this covers costs associated with hospital or skilled nursing facilities. Now, even though it's free, you do have an out-of-pocket expense, which is your per benefit period deductible. For 2019, it's $1,364. Now, per benefit period is every 60 days. So if you are out of the hospital and then go back in for the same occurrence, you do not have to pay that deductible again. But if you go back in for a different occurrence, you are subject to that deductible. So you could pay it more than one time in a year. So as you can see, it is quite important to get an additional Medicare policy than what original Part A offers you. Next is your Part B medical insurance. There is a monthly premium associated with Part B. For 2019, the average premium is going to be $135.50. And this covers your physician services, outpatient care, tests, and supplies. Now, there is a deductible associated with this as well. It's an annual deductible this time of $185. After you hit that deductible, you'd be responsible for 20% coinsurance. This is just a chart showing for the year of 2019 what you will pay based on your income. As you can see, the premium gets higher as your income gets higher. When to enroll in original Medicare? You will be enrolled automatically if you're receiving Social Security benefits or Railroad Retirement Board benefits. You'll get a package in the mail 3 months before you turn 65, and if you want to keep it, you just accept your Medicare card. If you want to refuse it, there's a box that you check on the back and you send the card back to Social Security. If you're not automatically enrolled, when do you enroll? You enroll, there's a 7-month window. It's 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after your 65th birthday. And you can enroll online at socialsecurity.gov, or you can go down to your local Social Security office. Now, that would be a good time to meet with your benefits administrator if you are still working. Medicare can be primary, where it would make you also enroll in your original Medicare Part A and B with your group health coverage. But usually if you're over 20 employees, Medicare would be secondary, so you do not have to enroll in your Part A and B of your Medicare, and you can just rely on your group health coverage if that's what's best for you. Still consult with a benefits administrator. And then If you continue on your group health plan and you don't accept A and B right away, maybe you're 67 and now you plan to retire and you'll be losing your group employer coverage, you want to start planning for that at least 3 months before you're retiring, so there's no possible way that you can get that late enrollment penalty. Timing is very sensitive for enrollment. Okay, you're on Original Medicare. You have Part A and B. You have two options for additional coverage. One there to the right is your Medicare Advantage plan, or your Part C. That works like an HMO PPO and usually includes your drug coverage. Or if you go down from Original Medicare, you'll see Medicare Supplement plans. Now, what a Medicare Supplement does is it fills in the gaps of Medicare. And then it does not include drug coverage, so you'd have to purchase a standalone prescription drug plan. Part C, Medicare Advantage plans. So it combines your Parts A and B of Original Medicare, so you are no longer subject to those copays and deductibles. Medicare Advantage would take that over. It's managed by private insurance companies. And then each plan has different co-payments, co-insurance, or deductibles for services. Medicare Advantage plans may cover certain services that are not covered by Original Medicare. Some examples are dental, vision, hearing, and fitness. You must be enrolled in your Part A and B to be able to enroll into a Medicare Advantage plan, and it works like an HMO PPO. When do you enroll in a Medicare Advantage plan? It has the same initial enrollment period as your Part A and B of Medicare. So it's the 3 months before your 65th birthday, the month you turn 65, and also the 3 months after you turn 65. And we want to make sure this date aligns with your Part A and B of Medicare to avoid any late enrollment penalties here as well. There also is a time of year every year called the annual election period, or AEP. It's October 15th through December 7th that gives you the opportunity to switch plans. So if you're on a certain carrier you're not happy with, during the AEP you can switch to another plan starting the beginning of the next year. Also, if you fail to elect a plan during your initial enrollment period when you turn 65, this time of year gives you the opportunity to enroll. There might be another time throughout the year due to life events that would give you a special enrollment period. And we always recommend using an agent to discuss the options for you. So selecting your Medicare Advantage plan, what are the questions to ask? How does this plan compare to my current coverage? Maybe you are turning 65, you're going to continue to work, but your premium for your group health employer coverage is getting too high and you have a high deductible. Maybe you want to see what Medicare could offer you. Obviously, compare the premium, deductibles, co-payments, and co-insurance amounts. Make sure your doctor is in network. Make sure all your drugs are covered under the plan formulary. Each carrier and plan has its own formulary, which is a list of drugs that they cover, and also at what tier they cover that drug at. And then what are the extra benefits that are offered? Maybe vision is something really important to you. You want to make sure that your plan you're picking has that included in it. And then travel coverage. Maybe you live most of your months out of the year here in Pennsylvania, but during our winter months, you move down to Florida. Good for you. I'm jealous. You want to make sure your plan has that travel coverage included. Is Medicare Advantage the right choice for you? There are pros and cons. Some pros are a lower monthly cost. Medicare Advantage plans run from $0 premium the whole way up to $200 a month. Those $0 plans are not too good to be true. They do involve really nice coverages for you. And I've heard some of our agent partners use this term before, is pay-as-you-go plan. The reason why they say that is because it does have that lower monthly cost, but then you are subject to co-pays and co-insurance once you use the coverage, so pay as you go. A pro is they have those extra benefits included as we discussed. And then there's also an out-of-pocket max protection, which is something that I like to call the second deductible. We all know what a deductible is. You have to pay that out of pocket before coverage applies. Well, this one protects you from paying any more after that. So it's your out-of-pocket max. You won't pay anything after you've reached that amount, and it's there for your protection. Another pro is you can adjust your plans annually during that AEP that we talked about. So some people really see that as a value. You're not locked into it for life. And then it has that travel coverage. Some cons are networks, right? You have to make sure your doctor's in network. If you need a referral for a specialist, you also have to stay in network. Copays, coinsurance, deductibles apply. If you have an HMO plan, some of them still do require referrals to see a specialist. And maybe you don't like that you have the ability to evaluate your plan each year. You find that as a hassle. So that could be a con as well. All right, moving on to a Medicare Supplement, which is your other option. As we mentioned before, Medicare Supplement fills gaps in original Medicare. So those deductibles and co-insurance that we talked about that A and B have, a Medicare Supplement will fill those for you. It's important to note that all the plans offer the same coverage per plan letter. So if you purchase a Plan G, for example, it doesn't matter which carrier you go with. A Plan G is a Plan G is a Plan G all day long, no matter the carrier. Medicare Supplement insurance is sold by private insurance companies, and we also refer to it as Medigap. So you'll hear me say that throughout the presentation. When to enroll in a Medigap. So this has a different enrollment period than your original Medicare and your Medicare Advantage plans. This 6-month window starts the day you enroll in your Part B. So you're eligible to enroll in a Medigap that first month that your Part B is effective, and then 6 months after that. And then you're in what is called your guarantee issue. So you do not have to answer any health underwriting questions, which is really nice. You can also buy a Medigap policy whenever a company agrees to sell you one due to qualifying events. So they call it guarantee issue rights, but there can be life events that occur that give you an ability to have a guarantee issue as well. And then there's no enrollment or annual enrollment period for Medicare supplements. You can actually sell them all year long, and if somebody's on a policy already, say they've been on a policy for maybe 10 years and their rate has got awfully high, you can re-quote them any time of the year for a cheaper rate to switch plans, but they will have to go through a health underwriting process to switch plans. Okay, here's a chart to show you all the plan offerings, Plan A through Plan N. As you can see, 100% is going the whole way down this chart for Plan C and Plan F. They are the two richest plans that you can purchase. Something to note is that they will be going away in 2020. That just means they won't be eligible for new people aging in. If you are enrolled in Part A and B of Medicare before the year 2020, you still will be eligible to purchase these plans. If you look, the next richest plan is the Plan G, and the only thing it's not covering at 100% is your Part B deductible, which in the year 2019 will be $185. So once they pay that amount, everything else is covered at 100%. Now, there are some things that aren't covered, obviously, in the Medigap policies, and that's something we can discuss one-on-one. I don't want to get too into the weeds during this presentation on that. Some pros and cons for Medigap. Is it the right choice for you? So pros, it's no networks. If the facility accepts Medicare, they will accept your Medicare Supplement plan. There's less out-of-pocket costs after your monthly premium. So as Medicare Advantage was pay-as-you-go, this one's pay up front. So you're paying a higher monthly premium for the average 65-year-old female in Pennsylvania. It's about $134 a month. And that makes it easier to budget. When you go to the doctor, you don't have to pay a copay. If anything catastrophic happens, you don't have to pay a copay. It's just that monthly premium. It's good for travelers within the U.S. because there's no network involved. You have that peace of mind knowing that you can budget and you know what that monthly expense is going to be. There's no financial risk. And then it also accepts pre-existing conditions as long as you were in that guarantee issue when you applied. Some cons are it's a higher monthly cost. There's no extra benefits, so no dental, vision, hearing. And then also there's no drug coverage, so you do have to buy a standalone prescription drug policy. Okay, moving on to Part D, prescription drug coverage. Part D benefits help you save on prescriptions. So Medicare prescription drug coverage is not automatic. You have to either buy a standalone policy or get a Medicare Advantage plan that has drug coverage included. Each Medicare prescription drug plan has its own list of covered drugs, which is called a formulary, which we discussed, and many of those drugs are placed on a tier. So, for example, generic may be a tier 1, where specialty drug may be a tier 5. When to enroll in prescription drug plan. This has the same 7th-month window as your original Medicare and your Medicare Advantage plan. So it's 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. Again, we want all the effective dates to line up and be the same date so that you avoid any late enrollment penalties. Now, these type of plans do have the annual enrollment period every year, which is October 15th through December 7th, where you can join, switch, or drop the plan. There are, again, times throughout your life, such as qualifying for extra help or low-income subsidy, that will help give you a special election period as well. Part D costs. So there are 4 stages to Part D. First is your deductible that you're responsible for. That can be anywhere from $0 to $415 in the year 2019. Then you're into your copays and coinsurance, where you're lining up with the tier of the drug. And then not everyone hits the coverage gap, or better known as the donut hole, but if you do, this is where you are paying a higher percentage for your drugs. And then if you spend a certain amount, you will hit the catastrophic coverage. And this is when the carrier is responsible for the higher percentage of the drugs, and you're paying a very minimum amount. There is limited income help out there for people that need it, such as Medicaid, which eligibility is determined by the state. You have to apply online or down at the office before you can enroll into a special Medicare plan. And then also there's extra help, which is determined by Social Security, and that helps you paying for your Part D drug costs. A few key points to remember from the presentation today. Medicare is a health insurance program. It does not cover all of your health care costs. You have choices in how you get coverage. There's no cookie cutter plan that is best for everyone. The individual has to determine what coverage is important to them, and you as the agent are there to help guide them through that decision. You're the educator. And there are programs for people with limited income, and decisions are time sensitive to avoid those penalties. There's some great additional resources out there for you to learn more on Medicare. We have some on our website at urlinsgroup.com/Medicare tools. We make quick reference guides and download all types of PDF, flyers, learning, educational tools there for you. And then also the government website. So there's Medicare.gov and CMS.gov. Well, that's me. I'm Christy Wilbert again, and thank you so much for joining me today. I hope that I did pique your interest and you're interested in selling some Medicare plans and products. If you are, please contact me and we'll schedule a one-on-one training, and I'll get you into the next step of selling. Thank you so much. Have a great day.